time has come in America to launch an intensive campaign to find a cure for cancer.
Our recovery plan will invest in electronic health records. It will launch a new effort to conquer a disease that has touched the life of nearly every American by seeking a cure for cancer in our time.
Since the war on cancer began in 1971, more than 14,800,000 Americans have died from some form of the disease. 1,500 die every day. That's 565,000 men, women, and children in 2009 alone. More people will die from cancer in this country in the next 3 years than all the American soldiers who died fighting since the American Revolution.
From 1920 to the present time, we have made little or no progress in the treatment of adult cancers. So a person who gets prostate cancer or breast cancer today will live as long as a person who got it in 1920. No big change. With all the radiation therapy that we began in the 10s and 20s, combination chemotherapy in the 60s, immunotherapy that began in the 70s, PET scans, MRI scans, you name it, billions and billions and billions of research dollars that we've thrown into this whole area of cancer research and treatment, little or no significant progress in the treatment of adult cancers.
They will burn it, they'll cut it out, or they'll try to poison it.
Heavy trading today in the biopharma sector.
Blockbuster cancer drug Erbitux racked up nearly $425 million in sales.
You have this entire industry that is not going to just pack up and go away. This is the business.
Hey Freebirds, it's Freely the Banana Girl here. Welcome to another episode. That was pretty good spin. Maybe because I got my Thai dancing pants on. I love these pants. They're like $5 from Thailand. Super comfortable. Probably going to get another 5 pairs when I get over there. So, okay, on to today's topic. It's a really, really important one. All right, it's something that touches the lives of millions and millions of people out there, and that is cancer. Almost all of us know someone who has had cancer, who has even died of cancer. It's that common. It's frightening. It's an epidemic proportion. It's wiping the population out, basically. 1 in 3 people is going to get cancer. And do they die of the cancer itself, or are they dying from the treatment? We're going to talk more about that today. And also we're going to talk about the business of cancer. Because if you're diagnosed with cancer and you go the conventional route, then on average, you're going to spend around $50,000 on treatments. $50,000, that's a huge amount of money. And with 1 million new cancer sufferers diagnosed every single year, that's $50 billion injected into the cancer industry. So there's a lot going on behind the scenes. There's a lot of greed, there's a lot of corruption, and we're going to talk about that today. So grab your banana smoothie and listen up. This is some excellent information.
Over 1 million Americans are diagnosed with a new cancer every year. All these people suddenly plunge into a dark tunnel that will dramatically change their life for many years to come. Faced with an apparently endless chain of medical tests, examinations, second opinions, medications, new tests, surgical operations, support therapies, and follow-up checks, they find themselves at the complete mercy of the disease. While in that tunnel, each patient feeds an immense medical apparatus that employs hundreds of thousands of people and generates millions and millions of dollars for the medical and pharmaceutical industries. From research laboratories to medical schools, from prevention clinics to worldwide drug sales. Today, the cancer medical apparatus is so large and expensive that it needs its patients in order to survive.
Okay, it seems crazy to me. I don't know, does it seem crazy to you that we keep doing the same thing over and over and over again and expecting a different result? We keep using the same conventional model over and over, but hey, it's not working. With a success rate of about 2 to 3%, why do we keep using it? There's a very good reason.
I'll never forget walking into the hospital that day. My father's cancer had spread. There was nothing they could do but give him 6 months to live and send him home to die. I remember the doctor well. He was a kind man with a difficult job. I admired my father's courage as he grappled with the news of his impending death. Years later, I met Mary Harrington.
I was diagnosed with malignant melanoma. At that point, he gave me 3 to 6 months to live.
How long was it before you started to notice changes?
I didn't die. So I knew something was happening. As a matter of fact, we were cleaning vegetables and my son turned around and said, "Mom, weren't you supposed to have..." And I said, "Been gone by now?" "Yes, but here, it's 7 months and I'm still here." 10 months on the diet, I had my first scan, and I was clear, and I've been clear since.
Mary's not alone. Every year, thousands of people reverse a wide spectrum of cancers by going outside the system to seek alternative treatments. As I researched these treatments, I couldn't help but think about my father's doctor. Why didn't he know about these? As I've come to find out, if he did know and recommended an alternative treatment for cancer, he could not only lose his license, but go to jail. This didn't make sense to me. It didn't make sense that Mary had to travel out of this country to get simple dietary treatments for cancer. Over the years, I've come to learn that when something doesn't make sense, if you follow the money, you'll usually find the answer. That's when I learned about the business of cancer. As you will soon discover, the search for a cure is hardly the altruistic endeavor you've been led to believe. In fact, it's quite the opposite. Even worse, when you look at the hard numbers, our current cancer treatments are appallingly ineffective.
This is Thomas using alternative therapy, and this is conventional therapy, 2 months worth.
See, this reminds me a lot of my partner Harley's dad's situation, okay? He was 87 years old, he's riding along on his bicycle, he has a fall, and he goes into the doctors for like a routine, like a bit of a checkup to see if he's okay. They give him a scan and they're like, "You have cancer." Next thing you know, they're like, "You're going to get into surgery, radiation, blah, 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 you don't have long to live." Freaking the poor guy out. And here's Harley saying, "Dad, don't have chemotherapy, don't have radiation, what are you doing? This is crazy." And of course, Harley's dad was very scared and he had a lot of faith in the medical model, as a lot of people do. So he had the radiation. And within 1 month, he was dead. We're talking about an 87-year-old man. How irresponsible of these people to even consider it. The doctors do a scan and all of a sudden it's like, "Cancer, we need to attack it, let's get it." And you know what? They destroyed his immune system and he died.
If conventional therapy has such limited results, why isn't the medical profession willing to investigate alternative approaches?
The answer to this question may be found in some historic events that took place almost a century ago, when official medicine finally managed to gain the upper hand on the so-called empirical doctors, who cured patients with herbs and natural remedies.
In the 1800s, society sanctioned both approaches to healing. Patients had a choice of using either doctors, called allopaths, or natural healers, called empirics or homeopaths. The two groups waged a bitter philosophical debate. The allopathic doctors called their approach heroic medicine. They believed the physician must aggressively drive disease from the body. The allopaths used 3 main techniques. They bled the body to drain out the bad humors. They gave huge doses of toxic minerals like mercury and lead to displace the original disease. They also used surgery, but it was a brutal procedure before anesthesia and infection control. Few patients were willing to have surgery. Most patients feared allopathic methods altogether. Satirists of the day remarked that with allopathic treatment, the patient died of the cure. A drug industry grew out of the booming patent medicine business. The doctors changed educational standards and licensing regulations to exclude the empirics. Soon, only AMA-approved doctors could legally practice medicine. In a brief 20 years, the AMA came to dominate medical practice. Organized Medicine launched a media campaign to associate the empirics with quacks. The code word for competition was quackery.
So not only did the natural doctors get pushed out by the wealthy conventional model, but they also got blackened. Their name got blackened, they got called quacks, okay? Anyone who wasn't practicing the conventional way was a quack. The interesting thing is, modern day doctors only get about 19 hours of nutritional training in their medical degree. 19 hours in the whole thing. They're doctors. They're meant to help heal people. They're meant to help, help people become aware of what they're eating and the impact it has on their organism. But instead, they're just trained to prescribe drugs.
I found that the average wife of these physicians knows more about nutrition than he does, but they sure know their drugs. And if you go to your typical doctor today, I don't care what it is, chances are you're going to walk out of there with a prescription. Why? Because that's what he has been trained to do.
So I used to work in a medical clinic with doctors, and we'd have pharmaceutical reps come in all the time, and they would spoil the doctors. Okay, they would offer them trips and, fancy equipment and all of this stuff. And then, of course, the doctors aren't going to want to recommend a healthy lifestyle to their patients, who are essentially clients, because that's going to stop the flow of drugs.
The companies that make up the pharmaceutical industry are among the largest corporations in the world. Together, these businesses have come to be known as Big Pharma. In 2004, their combined global sales were over $500 billion, with Pfizer and Johnson & Johnson leading the pack. In the U.S., the core of Big Pharma's immense profits is from sales of prescription medication. And since these drugs can only be prescribed by medical professionals, most of the industry's promotional and marketing activities are directed at doctors, pharmacists, and other healthcare providers.
This starts out at the first day of medical school, and in many medical schools, even the incoming students that are 2 years away from seeing a patient will start to get gifts from the pharmaceutical industry. And as these students get farther along in their medical education, the interactions and the gifts escalate to free lunches, to dinners.
Champagne, brunches, happy hours, New York jet tickets. No matter where you spend the money, you make money. And my boss always told me, don't worry about it. There'll always be more funding. Spend what you can. In fact, if I give you $100,000 to spend, Gene, I want you to spend $200,000.
Before 1980, most clinical research was funded by the National Institutes of Health. During the 90s, most of that research got pulled out of universities and was brought to for-profit research organizations.
Okay, so let's have a look at how successful conventional medicine really is. The fight against cancer, we've had this war against cancer since 1971. So let's have a look how effective it is.
A cure is just around the corner has been the standard public relations pitch used to pump money into the cancer industry. The medical community has been working on a cure for well over 100 years. The war on cancer was simply a massive infusion of funds, which ended up creating a bloated and ineffective medical bureaucracy. Some of those involved in the war saw this from the very beginning. Here are the results of a study of every randomized, controlled clinical trial performed in the U.S. between 1990 and 2004, which reported a statistically significant increase in 5-year survival due to the use of chemotherapy. What you see are goose eggs, or near goose eggs, for all of our major cancers. The medical profession generally considers any drug with less than 30% effectiveness to be no better than a placebo. What you see from studies conducted over the last 50 years is that for our major cancers, the effectiveness of conventional treatments is far less than a sugar pill.
So the effectiveness of the conventional approach is no better than a sugar pill, no better than a placebo effect, and actually bad for you because you're poisoning yourself, then we need to look elsewhere for the answer. And the answer lies in your lifestyle.
Today, ABC News has gone pink across every broadcast, saluting Breast Cancer Awareness Month and the search for a cure. But tonight we're also asking about prevention, specifically which women get the least breast cancer and why. ABC's chief medical editor, Dr. Richard Besser, brings us the answer.
Ask Mao Shiying in the Chinese countryside. A perfect example of what can happen if you eliminate breast cancer risks.
I have heard of breast cancer, but I don't know anyone who's ever had it.
Not in her village or in any village she knows. Rural Chinese women like Mao have the lowest rates in the world. She eats mostly rice and vegetables, little meat, little fat, which lowers her risk. A healthy weight and exercise lower it more. So here's what it looks like to have the lowest risk in the world. But if Chinese women like Mao move to the United States, studies show that within a generation, her daughters would have the same risk as an American woman, the highest risk in the world.
Our bodies cure cancer every day of our lives, and the difference between prevention and reversal is one of degree, not kind. In fact, the average American has 6 bouts with serious cancers during their lifetimes. That is, they actually reversed serious cancers 6 times in their lives without even knowing it. Those with healthy immune systems don't know about the battle their bodies are waging. Those with weakened immune systems will find out about these battles in the hospital.